So we're going to share with you first one of our IVs, one of our popular IVs, which is IV chelation therapy. And IV chelation therapy, we use it here to pull toxins out of the body because everyone has like heavy metals in their body from just the environment, from the foods that they eat. And so what we do know is that when the body is filled with a lot of these metals, that people have a lot of symptoms associated with heavy metal toxicity. So in addition to the heavy metal toxicity, just removing the metals out of the body, we also use the IV chelation therapy off-label to clean out the arteries. So we've been very successful here at reversing heart disease. You know, for us here at ACPM.net, heart disease is just easy to reverse.
So chelation therapy was developed decades ago, around actually World War II. The EDTA, which is a man-made amino acid called ethylene diamine tetracetic acid, was used. It was injected intramuscularly for workers who clean lead out of U.S. warships, so to speak. And serendipitously, it was found that people who had angina from clogged arteries actually got better. And that has been reproduced over the years, up until a particular tax study that was done by the National Institutes of Health. Most of the studies were poorly designed and not given much respect by the general medical community. But now we have a study that has been sponsored by the NIH, because the government had to do it, because EDTA, you can't make a lot of money from it. The drug companies can't make anything from it much because it's not patentable. It's past that time. So the study did show a significant decrease in hardening of the arteries. When you mix that with the plant-based diet, it really works quite well. We've also used it for other things like inflammatory problems. I had a woman who had a rash from neck down that was just ridiculous. And we were able to get rid of it using, we did food combining, we did food allergy panels and checked her bowels out for good and bad bacteria, candida. And then we decreased the metals in her body, which stimulate inflammation. And she had a rash that was inflammatory. So what we do, we mix these up. We have particular formulas that have been developed by the American College for the Advancement of Medicine. Then I put my own precautions and own different ingredients in to enhance the formula that we use. It's rather unique. There's different types of fluids we'll use depending on the person's circumstance. We may use D5 dextrose, which is a little bit of sugar in water, or we may use sterile water, or we may use half normal saline. Now, those are all medical terms, but we just decide which fluid is best. Certainly, one of the main ingredients is the EDTA. Again, that's a man-made amino acid, and what it does is form a three-dimensional microscopic molecular ring structure and pulls out heavy metals. It connects to them through electronic pathways, and then it releases it out through the urine, through the feces and the skin, mostly through the urine. And I take it myself, and when you urinate that, you can really feel and tell that you're getting rid of some poison there. Modern people have about 10,000 times more lead than before pre-industrial people. And we haven't always been responsible with our industries, so we poison the environment a bit. But this is a way to get rid of also that gas, that lead gas. Some of the after effects of that are still around the environment. So this gets rid of it. Lead and cadmium and arsenic and gadolinium, all these different elements that are toxic are gotten rid of. I even have people who had chemotherapy with platinum-containing chemotherapy. And that poisons the system and gives them a peripheral neuropathy, which means they may have tingling or weird sensations, and it can really downright hurt in the extremities. And the normal value for that is less than 0.1 micrograms of platinum per gram of creatinine, so platinum per creatinine. We get up to 365 units from 0.1 when we pull it out of the body. And they have a therapeutic response where their peripheral neuropathy at least temporarily decreases, and then it decreases a little bit permanently. And you just keep doing that intermittently. So EDTA is really important. I've had people come in who had 3 open heart surgeries. They were on 7 different medications, and we've been able to wean them off of all that. And one guy came in, he was like 89 years old, and at the age of 95, he was off this particular person was off all 7 drugs and volunteered to work in a health food store at 95 after having 3 open heart surgeries.
Did he go vegan?
Oh yeah, definitely. I mean, that's the vegan diet. The reason we say that is because epidemiological studies have shown that societies where they are vegan or near vegan, they just don't get the heart disease and the meat-related cancers we get here. By age 50, 85% of Americans all have hardening of the arteries. And a lot of that isn't even detectable by stress tests or cardiac caths. 85%. Even by age 20, 17% of Americans have hardening of the arteries. These other societies, they just don't have it. They literally don't have it. And these same societies oftentimes don't have our top 4 cancers, which are breast, colon, prostate, and lung. They just don't have it. So this even helps get rid of the propensity for that, because cadmium, for instance, can make cancer cells grow. And this gets rid of cadmium as well. And it's measurable, so it's pretty awesome, actually. To that, we add a lot of different ingredients, because a lot of times we're dealing with high blood pressure. We want to tone the heart. So one of the things that tones the heart is an ingredient called taurine. So taurine is one of these ingredients. I'm not going to bother to read which one's making. But taurine is an amino acid that literally tones the heart. It makes the heart work better, increases the efficiency of the heart. Another ingredient we may add is vitamin C. A lot of times we add it to bring up, let's say, to make it the same osmolality as blood. In other words, to bring up the salt a little bit. Vitamin C can be good for you anyway. And then a very important ingredient that's absolutely necessary in every chelation bottle is magnesium. Because as we age, cells there's cells around the blood vessels, the arteries in particular, that open and close and relax. And when we age, we lose the magnesium that relaxes the blood vessels, and they absorb calcium. So the calcium makes it hard. That's where you get hardening of the arteries. Sometimes you can take an x-ray and see calcified arteries. So what the chelation does, it pulls calcium out of this muscle cells surrounding the coronary arteries. The coronary arteries are the arteries that supply the heart. And I don't want to bore you with all this. I'm very excited about it myself.
So what does so we use 2 different types of magnesium in our chelation IVs. We'll use either magnesium chloride or magnesium sulfate. So for some of our patients who come here, they're coming because they're getting chelation therapy because they have high blood pressure. And so magnesium sulfate helps to lower blood pressure. So our chelation therapy IVs are customized per the patient. So if there's a patient that has high blood pressure, then we have different water that we would put their ingredients in.
Or if they're diabetic.
Maybe
different,
so
everything's
Dr.
customized.
Richardson has been customizing and these IV chelation for years. I mean, he's really one of the best out there when it comes to formulating IV chelation therapy.
And I'm training. We have hired 3 doctors, 3, and 1 nurse practitioner. I'm training them as well to carry them on.
Yes.
And we even have students follow us around who are pre-med students. Some of them quite brilliant, I would say. Yeah. So the magnesium is important, and then we may use magnesium chloride in the vitamin C IVs that we use for in the high dose vitamin C, because vitamin C will pull chloride out the bottles, out the body. I'm sorry. So we'll use chloride in that instance. So it's pretty interesting, actually.
What type of vitamin C do you use?
We use, well, it's a non-corn vitamin C, and it's a pharmacological vitamin C, so it's literally ascorbic acid, sodium ascorbate.
It's cassava.
Cassava, yeah,
So
non-vitamin
it's
C,
non-corn,
tapioca,
so
yeah.
it's, yeah.
Yeah. Yeah, and does that answer your question? Okay, good. Sometimes we'll put in sodium bicarbonate, and that's to buffer the certain ingredients where you don't have to do that. We put in a little bit of lidocaine just to decrease any discomfort. We put in vitamin B12, vitamin B6, and B complex because we want to replenish the B vitamins. That gives the body a boost. And vitamin B6 is particularly important. Glutathione does intracellular detoxification. It helps pull heavy metals out of cells to get to the surface for the chelation to work. That's glutathione. It's a amino acid. Well, it's a tri-amino acid. It's 3 amino acids, and it's also crosses the blood-brain barrier too. So it helps pull metals out of the brain, which is important.
Yeah.
It's also great for neurodegenerative diseases, for Parkinson's and such.
And also with glutathione, a lot of people are deficient in it, for one thing. And in addition, glutathione, if you're deficient, those detoxification pathways that we have in our body can be blocked. So you're not able to detoxify if you are low in glutathione. So by adding the glutathione and then the precursor to glutathione, which is the
L-cysteine.
L-cysteine.
N-acetylcysteine. And that goes intracellular and aids the body to act as a precursor to glutathione. It's one of the main ingredients that, or main substrates or precursors that make glutathione go. So that just enhances the whole situation.
Right.
Yeah.